But as a doctor, Tanya, could you sort of walk us through the process, if assuming, but at this juncture, I would also like to say that fed is best. Because the main thing is to make sure that your baby is healthy and that your baby is fed. And the way you do it is something that, is up to you.
I think it's your own choice, actually, isn't it? That you have to, I feel that the main thing is that, like as a medical professional, I would want to know that I had educated a mom, that I had taught her how to feed, because I think that's where we're really lacking, right? That often, doctors also don't provide that support, that if you have antenatal classes, you know what to expect. If when your baby is born, if your obstetrician has told you that, yes, look, that you'll be breastfeeding, we'll support you in it, if that's what you'd like to do. If the midwife can help you with latching on, with positioning, with attachment, can troubleshoot for you in the postnatal ward, and if your pediatrician is also supportive, that's what you need, And I think that too often a lot of doctors also want that control. So they want to know, okay, how much is the baby drinking? I don't want the baby's blood sugar to drop. And so they will, a lot of babies I feel who are born here, particularly who are born privately, will immediately be whisked away to the nursery, will be given a bottle of formula, and then will be sent back. And that way you've kind of already made that choice for the mom, So I feel that, yes, that the choice is up to the mom, but that you should train her and prepare her fully so that she feels confident in making her decision.
And I think it's really strange that a lot of setups don't have that kind of conversation when you go in, and even with, like you said, it's between your obstetrician and your pediatrician, and also some kind of nursing support, where it seems like a lot of pieces have to sort of fall into place to talk about it.
And and I feel even, for example, breastfeeding rooms, So when you have a baby who's admitted, like it's hard enough if your baby is born and is well and is with you in the room, But if your baby is actually unwell or is premature, is admitted to the baby unit, then it's far more challenging, right? Because actually for the hospital, they need to have a screen, they need to have maybe a separate room where you can go feed the baby, or where you can go and express, and the expressed milk can be given. So there needs to be a lot of support, from the medical profession towards that.
Quite right.